Changes to your skin are unavoidable with radiation, but there are some things that you can do to lessen the effects. This video will cover some of the things that I did, but more of the things that I wish I did in retrospect. Hi, I'm Erica. I'm a breast cancer thriver and a chiropractor. Radiation skin changes or the burns that you see can be quite variable from person to person. What works really well on one woman may not work as well on another. I'm going to mention quite a few products as I go through the video, so I put all the links in the description below. Check with your healthcare team on the specific recommendations for your case. Let's start with the easy things first, like keeping your skin clean. This probably doesn't seem like it's a big deal at the beginning of radiation when your skin looks fine. But as you progress through radiation, your skin will change and there may be some open areas of skin. Keeping your skin clean helps to reduce the risk of infection, and that's a good thing because as if radiation isn't already enough to deal with. You can wash daily with an unscented soap, rinse with water, and then pat dry. Easy. You'll want to avoid using any washcloths, loofahs, or brushes on your skin. The second strategy is sun protection. Your skin is going to be more sensitive to sunlight while you're going through radiation, and when you're done, this continues just to a lesser extent. The easiest way to protect your skin from sun exposure is covering up. I had radiation during the summertime, so I ended up wearing these tank tops that came quite high up on my neck. They covered my lower neck area and then my entire breast and chest, so they worked really well. I didn't swim while I was going through radiation as there's a higher risk of infection if you do that, but once my skin symptoms settled down, I did. I ended up wearing those rash guard shirts or sun shirts over a bathing suit if I was at a pool or beach. The second easiest way to protect your skin is using sunscreen. Because there can be a lot of chemicals in sunscreens, you may be avoiding this altogether or choosing non-toxic sunscreens. A few of the favorites that I use are listed in the description. The third strategy is daily moisturizing. In general, after 1 to 2 weeks of radiation, your skin will start to show some of the effects. Applying cream is one of the biggest things that you can do to address these skin changes. It can also help make your skin feel more comfortable as you're going through treatment, reduce the risk of infection, and help your skin recover better after you're done treatment. So moisturizing can minimize a skin reaction, but it won't prevent it completely. What type of cream can you use? My radiation team wasn't really particular with what type of cream they suggested for me. Because of this, I had assumed that all creams are alike, and choosing one over another wouldn't make that much of a difference. I ended up using a cream that I already had at home. It was unscented and had clean ingredients, so I thought it would be fine to use. It was fine, but in retrospect, this is one of the things that I would have looked into much more. In doing some research after the fact, I've read enough to know that women swear by a few products. The ones that come up the most are Aquaphor, Eucerin, and CeraVe. I would have definitely used one of these if I had known more at the time. These creams help to trap moisture inside the inner layer of the skin, forming a protective barrier. This will reduce water loss and the skin will be better hydrated. Where should you apply the cream? Before I get into the areas, be sure to wash your hands before you put on the cream each time to reduce the risk of infection. At the early stages of radiation, it's really hard to tell exactly what areas are being radiated because it's really not that obvious with the skin changes at that point. It's normal to see some areas of redness 1 to 2 weeks into radiation, but because the effects of radiation are cumulative and delayed, you really don't see the full effects until you're well into treatment. For breast cancer, in general, the areas in the radiated field include the breast area, or if you had a mastectomy where the breast tissue used to be, the entire chest wall, and this includes the upper chest, inner, outer, and underneath the breast. And there's also a few areas that target your lymph nodes. These are in your underarm area, above your collarbone, and then along the inner chest. You'll want to moisturize all of these areas. For some reason, I focus much more on moisturizing my breast and chest, especially that upper chest area. I was told by my radiation team that other areas were going to be radiated as well, but I didn't realize there would be so much of a difference from one area to another in terms of the skin changes. Had I known what my underarm area was going to look like compared to the other areas, I would have spent way more time moisturizing this area. Ask your radiation oncologist or therapist exactly which areas are being radiated so you know which areas to focus on when you're moisturizing. Since you're going to be applying so much cream, make sure you wear some tops that you don't care too much about because they're going to get a lot of cream on them. Whatever cream that you do end up using, be sure to only use it on skin that's intact, so meaning not open. And this also goes for sunscreen. You'll want to pay particular attention to areas that have more friction, which means there's more risk of open skin and blistering. So lots of moisturizing in these areas. The areas get the most irritated are where two areas of skin come together. This happens in the underarm area as you'll get friction from the armpit rubbing against the arm skin basically every time you're walking and swinging your arms or just with everyday movements. It's also a much more sensitive area to begin with. Another area of friction, especially with a lumpectomy, is under the breast fold, as that lower area of the breast skin may be touching the skin below it. There can also be friction from the band of your bra in that area. I had tissue expanders when I had radiation, and it's not as common to have that friction in the area because the lower breast area doesn't usually touch the skin below. That would be similar with implants. And if you had flat closure, this wouldn't apply. How often should you apply cream? You can apply cream several times a day starting the first day of radiation. You can continue to apply it throughout radiation and even beyond radiation until your skin settles down. The peak of skin changes after radiation are usually 1 to 2 weeks after you're done. Mine was 9 days after. The skin will begin to heal about 2 to 3 weeks after you're done radiation. The fourth strategy is when you need more than a moisturizer. Not everyone does, but you may reach a point where you have some of those open, moist areas of skin. If it doesn't happen, it's usually in the latter stages of radiation or in that 1 to 2 week period after you're done. If your skin is getting really irritated, ask your radiation therapist or oncologist if there's any additional cream that can be used at this time. Your radiation therapist will monitor the progression of your skin changes pretty closely throughout treatment. They would check mine at the start of every radiation session. I remember asking them week by week what my progress looked like as compared to what they normally see. I also had appointments with my radiation oncologist once a week as I was going through radiation, so she was checking my skin at those appointments as well. My radiation therapist gave me a protective cream during the last week of radiation. It's a barrier type of cream that protects the skin from further irritation. She wanted me to put this on the areas that were more irritated and also on areas where the skin may open up. It was helpful, but not magic. I kept using the other moisturizer on all of the surrounding skin, or basically the skin that was intact. My underarm area was starting to almost mini blister and then peel, and then had that little bit of raw skin underneath. It was pretty uncomfortable, but again, surprisingly, up until that point, it didn't really hurt that much. I was able to connect with my radiation oncologist, and she prescribed a topical antibiotic ointment. The ointment significantly helped, and the pain was so much better in 1 to 2 days, and it looked much better too. Check to see what services are offered at your hospital ahead of time so you know what options you have. I found that if you do have any of those blisters, once it gets to the peeling stage, it's really not uncomfortable after that. The fifth strategy is saline soaks. Saline soaks are a mixture of water and salt, and they're applied with a cloth on your skin to the areas that were radiated. I covered the exact steps to follow in a previous video. It's pretty simple to do, and it was way more helpful than I expected. Saline soaks help to keep radiated skin clean, reduce the risk of infection, and reduce a bunch of those really common skin symptoms in the latter stages of radiation or the 1 to 2 weeks after. I put face cloths over 3 areas: my breast, my upper chest, and my underarm area. I started doing saline soaks in my last week of radiation, which was when my skin was visibly starting to get a bit worse. It was also starting to get a bit itchy and sore. I did saline soaks a few times a day and continued until the peak of my symptoms. I noticed they help with the general discomfort in the area pretty much immediately. My skin didn't feel as irritated and itchy, and it seemed to at least temporarily help with some of that redness. To save time and make this something that I could do easily a few times a day, I did all of the areas at the same time and then used a tensioner bandage to secure the face cloths in place. The 6th strategy is let your skin breathe. During my last week of radiation, when my skin was starting to get irritated, my radiation therapist suggested that I go without a shirt at home whenever I could. This helps to air dry your skin, and then you also don't get the friction of your clothes rubbing on your skin. I ended up doing this for a number of days. I also opted not to wear a bra at home some of those times, and then also when I was out and wearing a shirt, I went braless as well. My sensation in my breast area wasn't the greatest after my mastectomy, which is normal, but I still didn't want anything really touching my skin in that area, especially if it was tight or rubbing. If you found these radiation skincare tips helpful, hit that like button to let me know. If you've already had radiation, or maybe you're doing it right now, let me know in the comments below what's worked the best for you. I'd love to share this with other women who are watching this video before the radiation. This next video takes a look at one of the longer term side effects of radiation called radiation fibrosis. See you there.